It's one small step for man, one giant leap for mankind.
When I was young, I really thought about becoming an astronaut. Seeing people walk on the moon was very cool, but given that that wasn't a really practical thing, the next best thing came in being a physician. What's unique about being a GYN oncologist is that not only do we do surgery, but we also administer chemotherapy, we help plan radiation, and so we're almost like the primary care doctor for women with gynecologic cancers. It's a really great job to have. I consider most of my patients, as I get to know them, actually friends of mine. I think what's been really neat about the last 6 years is that we have been able to introduce robotic surgery into our practice of gynecologic cancer surgery. It's a minimally invasive surgery, and so we utilize usually 4 or 5 tiny little incisions. The incisions are usually less than the size of my thumbnail, and through these tiny little incisions, we are able to do very, very complex cancer surgery for patients. Patients usually go home the next day, they can get back to work. I think the other thing that's really exciting is just we've seen an explosion of new drugs that are available for cancer therapy, particularly very targeted therapies without so many, disastrous side effects like we see from so many chemotherapies. We really incorporate the multidisciplinary team. So, we incorporate social work, we incorporate nutrition, we work with physical therapy. We're all working together with sort of a unified purpose. Not only do we have multidisciplinary cancer care here, but we also have the entire strength of the research that comes from the Fred Hutch that allows us to offer many more clinical trials than other institutions do. Many times, this will be one of a few places in the country where you can, get a novel drug to specifically target a certain pathway. We also have a great survivorship program. So women who've had cancer and who are in remission, we talk about how can we keep this cancer from coming back? What are the important things to do? They're small things, but they can make a big difference. We really have that entire package here at the SCCA.